Now, the Royal College of Nurses is set to announce its biggest ever strike after reports that a large majority have indeed voted in favour of a walkout over pay. The government says it does have contingency measures in place for the strike action and that the most essential services will be prioritised, as they say. But if the strikes take place, they would affect non-urgent but not emergency care, we're being told. Let's get more now with Lucy Johnson joining us, health editor at the Sunday Express. Lucy, thanks for your time. What are you learning about the ballot result as such?
Well, it looks like there is going to be a strike, and it is, we've really hit the buffers now that nurses are going to strike. It is pretty unprecedented, and they don't do it easily. If you look at it, nurses do earn less than the average. They earn less than teachers on average, and we've got nurses going to food banks. So in a way, I do have every sympathy for them, and they've had a sort of decade of real-term wage cuts, such that they're effectively doing a day free each week because of the cuts they've had over the last 10 years. So it is a huge problem, but of course it's one that, if we look at in the broader context, we've been quite happy to spend a lot of money, 400 billion on COVID countermeasures. A lot of that was to private companies, and we really need to start investing in people, and that's one thing that seems to have been overlooked. And it's happening across the NHS, across the board. We have a shortage of all NHS staff.
The government's saying that NHS staff overall received an average pay award of 4.75%, which they say has been sort of fairly reasonable. But obviously, given the rate of inflation and, as you say, that where they started from on that sort of platform, clearly just in cash terms, a lot of these health and nursing staff are struggling.
Yes, I think so. And with inflation running at 10%, it's not going to cover their costs. And we do know that nurses are going to food banks. And another problem, actually, my mum's a nurse, and I talked to her a lot about this, and she's very passionate. And one thing she feels very strongly about is the fact that, when she trained decades ago, you were paid to train. Nowadays, nurses have to fund their own way, and then they end up, with a starting salary of 21,000 about, and with a massive debt. So that's a disincentive to go into the profession in the first place. So really, nurses, I think, must be very, very angry to, I think most of them don't, they do care. They don't want to have to do this, but I feel that many of them feel there is no option. So I think that, we need to, the NHS in a round is sort of going back to the dark ages, isn't it? We're having people that are dying, waiting for care, or not getting care at all. And we need to look at the whole system and try and work out, how to reform it, because it's not working.
And as you've touched on it, not just the pay, but the staffing as well. Clearly, that is affecting the conditions. What is this likely to do, however, for frontline care? We're being told that it may be what they call a bank holiday service. Clearly, that no nurse or member of medical staff is going to let people suffer. But there will, I guess, be added pressure now on the waiting list, for instance.
Well, we have a 7 million waiting list at the moment, so 1 in 10 of us is waiting for, and that's going to add to that. And even though people, no medical professional will want people to suffer, people are suffering. They're already suffering. People are dying with cancers or are presenting late with cancers. We've had 30,000 excess deaths from heart disease, and we're seeing pandemic levels of excess deaths, something like 1,500 excess deaths every single week. In the last week we saw that, and most of those are not COVID related. So people are already suffering and dying as a result of the system, which is breaking down. And we need to look at it as a whole, I think. And if nurses strike, then other people, there's a lot of ancillary staff, there's porters, there's a huge amount of people that the NHS employs. They have every right to strike too. And then is it teachers? Is it police? Is it, there's lots of public sector workers that have a good justification to go on strike as well. Are we facing a winter of discontent?
Well, indeed, yeah. As you say, with obviously the government indicating that public pay awards may be capped to about 2% on November the 17th. We shall learn that as it comes around. But Lucy Johnson, health editor at the Sunday Express, thanks very much indeed for joining us here on GB News Live. Thanks for your time.
Thank you.